Welcome to Cam in Medicine. Today we're diving into an intriguing topic, what your hands can reveal about your health. We often think about our hands as tools, instruments we use every day. But did you know they can also be windows into what's going on inside our bodies? It's true. Subtle changes in the color, texture, or even the shape of your hands can sometimes signal underlying health conditions. Now don't worry, we're not talking about becoming diagnosticians overnight. But being aware of these signs and knowing when to consult a healthcare professional can make a world of difference. Stay tuned to learn about 7 surprising signs your hands might be showing you. Please remember that the topics covered on this channel are for educational purposes only and should not replace professional healthcare. Let's get started. Have you ever noticed your palms looking a little redder than usual? Not just a temporary flush, but a persistent redness, maybe even a little blotchy. This, my friends, is something we call palmar erythema. Now, before you panic, redness in the palms can be caused by a number of things, some as simple as a change in temperature. But when it's persistent, it could be a sign that your liver is struggling. The liver plays a vital role in filtering toxins from our blood, and when it's not functioning optimally, those toxins can build up. One way the body tries to deal with this buildup is by increasing blood flow to the surface of the skin, which can manifest as palmar erythema. So, if you're noticing this symptom, especially if it's accompanied by other symptoms like fatigue, jaundice, or abdominal pain, it's crucial to get checked out by a healthcare professional. Remember, early detection is key when it comes to liver health, and addressing any potential issues promptly can make a world of difference. So don't ignore those red palms. They might just be trying to tell you something important. Did you know that the length of your fingers could hold clues about your hormonal balance? It might sound strange, but it's true. Studies have shown a correlation between finger length ratios and exposure to hormones like testosterone and estrogen in the womb. Specifically, we're looking at the length of your index finger compared to your ring finger. This is known as the 2D to 4D ratio. Generally, men tend to have shorter index fingers compared to their ring fingers, while women tend to have a more similar length between the two. Now, what does this mean for your health? Well, a longer ring finger relative to the index finger in men has been associated with higher testosterone exposure. Conversely, in women, a longer index finger relative to the ring finger can indicate higher estrogen exposure. While these differences in finger length ratios are fascinating, it's important to remember that they are just one piece of the puzzle when it comes to hormonal health. If you have any concerns about your hormones, always consult with a healthcare professional. We rely on our hands for so much, so when our fingers start to feel swollen, it can be more than just a minor inconvenience. While there are many reasons why you might experience swollen fingers, one often overlooked culprit is your thyroid. The thyroid, a small butterfly-shaped gland in your neck, plays a big role in regulating your metabolism. When it's underactive, a condition known as hypothyroidism, it can cause a cascade of symptoms, including fluid retention. This fluid retention, also known as edema, often shows up in the extremities, like your fingers. So if you're noticing puffiness, tightness, or swelling in your fingers, especially if it's accompanied by other symptoms like fatigue, weight gain, or dry skin, it's essential to get your thyroid checked. A simple blood test can determine if your thyroid is functioning correctly and help you get on the right track to feeling your best. Remember, your hands are often the first place you notice these changes, so pay attention to what they're telling you. Our nails can be a surprisingly accurate reflection of our overall health. When we're healthy, our nails tend to be strong, smooth, and have a healthy pink hue. But when something is amiss inside our bodies, our nails can be one of the first places it shows up. One such sign is pale nails. While the occasional pale nail might not be a cause for concern, consistently pale or even white nails can sometimes indicate an underlying health condition, most commonly anemia. Anemia occurs when your body doesn't have enough healthy red blood cells to carry oxygen to your tissues. This lack of oxygen can cause your skin, including the skin under your nails, to appear pale. Other symptoms of anemia include fatigue, shortness of breath, and dizziness. If you're concerned about the color of your nails, or if you're experiencing any other symptoms of anemia, it's crucial to consult a doctor to determine the underlying cause and discuss appropriate treatment options. Have you ever noticed thin, red, or brownish-red lines that appear to be under your fingernails? These lines, known as splinter hemorrhages, might seem like a small detail, but they can sometimes be a red flag for a more serious health concern. Splinter hemorrhages occur when tiny blood vessels called capillaries under the nail bed rupture. While they can be caused by trauma to the nail, such as hitting your finger, when they appear without an obvious injury, it's essential to pay attention. One possible cause of unexplained splinter hemorrhages is endocarditis, an infection of the inner lining of the heart. While endocarditis is a rare condition, it's a serious one, and early detection is crucial. Other potential causes include certain autoimmune disorders, blood clotting disorders, and even reactions to certain medications. If you notice splinter hemorrhages on your nails, especially if they are accompanied by other symptoms like fever, fatigue, or shortness of breath, don't hesitate to contact your doctor. Our fingers come in all shapes and sizes, but have you ever noticed your fingertips becoming rounder and thicker over time? This phenomenon, known as clubbing, is a gradual change that, while painless, can be a visible sign of an underlying health condition. Clubbing occurs when the tissue beneath the nail bed increases, causing the fingertips to become enlarged and the nails to curve downward. While the exact mechanism behind clubbing is still not fully understood, it's often associated with chronic lung disease and heart disease. In these conditions, the body struggles to get enough oxygen, and clubbing is thought to be a way for the body to try and increase blood flow to the extremities. Other potential causes of clubbing include liver disease, inflammatory bowel disease, and even certain types of cancer. If you notice any changes in the shape of your fingertips or nails, it's crucial to consult with your doctor. Early detection and diagnosis of the underlying cause are essential for effective treatment. Our hands can get cold from time to time, especially in colder weather. But when your fingertips turn blue, even when it's not particularly cold, it can be a sign that something is amiss with your circulation. Blue fingertips, also known as cyanosis, occur when there's a decrease in the amount of oxygenated blood reaching your extremities. One of the most common causes of blue fingertips is Raynaud's phenomenon. Raynaud's is a condition that causes the blood vessels in your fingers and toes to narrow temporarily, restricting blood flow. This can cause your fingertips to turn white or blue and feel cold and numb. While Raynaud's itself is not usually serious, it can be triggered by other medical conditions such as lupus or rheumatoid arthritis. Other potential causes of blue fingertips include heart problems, lung problems, and even exposure to certain chemicals or medications. If you experience blue fingertips, especially if it's accompanied by pain, numbness, or other unusual symptoms, it's essential to seek medical attention promptly. Thanks for watching. I hope this video has empowered you to pay closer attention to your amazing hands. Remember, they're not just tools, but incredible messengers that can provide valuable insights into your overall well-being. While these 7 signs are fascinating and potentially indicative of underlying health conditions, it's crucial to remember that this video is not a substitute for professional medical advice. If you notice any of these signs or have concerns about your health, please don't hesitate to reach out to your doctor or a qualified healthcare professional. Take care of your hands, and they might just take care of you. Don't forget to like, share, and subscribe for more health insights. Until next time, stay curious and stay healthy. And as always, take care until next video.